Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about approach to microcytic anemia and iron metabolism, including iron regulation and laboratory assessment. Microcytic hypochromic anemia, as the name suggests, is the type of anemia in which the circulating erythrocytes are smaller than the usual size and have decreased red color. The cause of microcytic anemia includes acquired and congenital causes, which should be considered separately according to the age of the patient, risk factors, and coexisting signs and symptoms. Age-specific parameters should be used for patients younger than 17 years. The etiology of anemia depends on whether the anemia is hypoproliferative or hyperproliferative. Hypoproliferative anemias are further divided by the mean cell volume into microcytic, normocytic, and macrocytic anemias. Most microcytic anemias are due to deficient hemoglobin synthesis, often associated with iron deficiency or impaired iron use. The laboratory evaluation of microcytic anemias focuses on screening hematologic studies, followed by more definitive tests to distinguish iron deficiency anemia, the anemia of chronic disease, hemoglobinopathies, or sideroblastic anemias. Iron is required by every cell in the body. It has vital roles in oxidative metabolism, cellular growth and proliferation, and oxygen transport and storage. Iron must be bound to protein compounds to fulfill these functions. Iron in inorganic compounds or in an ionized form is potentially dangerous. Iron is absorbed through the enterocyte of the duodenum and into the plasma via the portal circulation. There it binds to apotransferrin for transport to cells, such as the developing red blood cells. In red blood cells, the iron is used in hemoglobin that circulates with the cell until it becomes aged and is ingested by a macrophage. There the iron is removed from the hemoglobin and can be recycled into the plasma for use by other cells. The level of stored and circulating body iron is detected by the hepatocyte, which is able to produce a protein, hepcidin, when iron levels get too high. Hepcidin will inactivate the absorption and recycling of iron by acting on enterocytes, macrophages, and hepatocytes. When body iron decreases, hepcidin will also decrease, so that absorption and recycling are again activated. Iron is distributed among three compartments. The storage compartment is the iron that is not currently functioning but is available when needed. The major sources of this stored iron are the macrophages and hepatocytes, but every cell, except mature red blood cells, stores some iron. The second compartment is the transport compartment of iron, that is in transit from one body site to another in the plasma. The functional compartment contains all iron that is functioning within cells. Though most of this is the iron in hemoglobin, the iron in myoglobin and cytochromes. Serum iron can be measured colorimetrically using any of several reagents such as ferrozine. The iron is first released from transferrin by acid, and then the reagent is allowed to react with the freed iron, forming a colored complex that can be detected spectrophotometrically. Transferrin can be measured directly by immunochemical methods. It is usually measured functionally as the maximum amount of iron able to be bound in the serum. Serum iron is carried throughout the body, bound to transferrin, occupying about 1/3 of transferrin binding sites. The measurement of the maximum concentration of iron that it can bind to transferrin is called the total iron binding capacity. TIBC is actually an indirect measure of transferrin. Since the TIBC represents the total number of sites for iron binding and the serum iron represents the number bound with iron, the degree to which the available sites are occupied by iron can be calculated. Percentage transferrin saturation is calculated by dividing serum iron by TIBC and multiplying the result by 100. The development of the serum immunoassay for ferritin provided a convenient assessment of body iron stores. Ferritin is an intracellular protein, which is secreted by macrophages into plasma. The level of serum ferritin has been shown to correlate highly with stored iron as indicated by Prussian blue stains of bone marrow. Hemosiderin is a heterogeneous aggregate of carbohydrate, lipid, protein, and iron. Up to 50% of its weight is iron. Hemosiderin is found primarily in macrophages and is formed by the partial degradation of ferritin. Prussian blue is actually a chemical compound that forms during the staining process, which uses acidic potassium ferrocyanide as the reagent. The ferric ion in the tissue reacts with the reagent, forming the Prussian blue compound that is readily seen microscopically as dark blue dots. Prussian blue stain is considered the gold standard for assessment of body iron. Cells regulate the amount of transferrin receptor on their membrane based on the amount of intracellular iron. When intracellular iron drops, the cell expresses more transferrin receptor on the membrane. A truncated form of the receptor is shed into the plasma and can be detected with immunoassay. Zinc protoporphyrin accumulates in red blood cells when iron is not incorporated into heme molecule, and zinc binds instead to protoporphyrin 9. Zinc protoporphyrin is easily detected by fluorescence. Some hematology instruments are able to report a value for the amount of hemoglobin in reticulocytes. It is analogous to the mean cell hemoglobin, but just for reticulocytes. Because, under normal conditions, the number of circulating reticulocytes represents the status of erythropoiesis in the prior 24-hour period. The amount of hemoglobin in reticulocytes provides a near real-time assessment of iron available for hemoglobin production. The hemoglobin content of reticulocytes will drop when iron for erythropoiesis is restricted. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.